of such materials are there. So this application is very important. How these materials are of great importance in drug delivery, rather in controlled and sustained drug delivery. Now, before going to that, let me explain the difference between the traditional drug delivery system and the controlled drug delivery system. In case of traditional drug delivery system, what we are doing, we are taking the medicine, and the doctor will ask us to repeat that medicine after 6 hours. And again, we will take the medicine, and after 6 hours, again the impact of that medicine is over, and again we are taking the medicine. Means we are repeating the medicine after every 6 hours. Why? Because impact of any medicine in the body will always remain in the will always depend upon its applies plasma concentration. The impact of any medicine in the body always depends upon its plasma concentration. How much concentration is in your blood plasma? That depends always upon that. Yeah. So if that plasma concentration, when we take the medicine, when it increases, its concentration of blood plasma will increase and will reach the maximum. And you will see the upper figure here in traditional drug delivery system. The upper limit you'll find, once it crosses the upper limit, you'll find that it becomes toxic. Toxicity will be there. And slowly, the concentration in the blood plasma will decrease and will reach the minimum. They will find here the lower limit. Once it reaches the limit, minimum here, it means the impact of that medicine is no more, and you have to take again the tablet. And again, its concentration will start increasing the blood plasma, and again it reaches the maximum limit. And after crossing the maximum limit, the toxic impact will be there. So this way, the cycle is repeated in case of traditional drug delivery systems. But in case of control, and moreover, when we are taking the drug, it reaches the stomach. The pH of stomach is around 2. Everyone of you know that hydrochloric acid is there. In the stomach, the drug may get metabolized. If it gets metabolized, definitely different metabolites will be formed. And those metabolites which are formed, they may have different side effects, toxic side effects in the body. That's most of the allopathy medicine, they have got side effects. And next problem here is, if it doesn't get metabolized, it will reach the intestine. And once it reaches the intestine, definitely it will get absorbed through the GI tract into the blood. But in between the GI tract and blood, there is a wall that is known as the lipid wall. And now, here the absorption of the drug depends upon its structure. If the drug is ionic in nature, definitely it will be highly soluble in water. If it is highly soluble in water, definitely it will get out of your body through the kidneys. That's the main problem. And if drug is a non-polar in nature, then what will happen? It will get absorbed over that lipid layer, which is present in the GI tract. It will get absorbed. First, it will get absorbed over the lipid layer, and then slowly it will go to the bloodstream. That's the main problem. Again, another problem because of which you'll find that most of the drugs, hardly 15, in case of most of the drugs, hardly 15 to 20% of the drug reaches the desired site. The rest goes waste. So that's the main problem with the traditional drug delivery system. Now, if we come to the controlled drug delivery system here, you'll find that this is the upper toxic limit, this is the lower limit, and this is the optimum concentration of the drug which must be in the blood plasma. And with the help of these such devices, we can maintain the optimum concentration of the drug in the blood plasma. And moreover, second advantage is here is we can implant such devices. You can implant such drug-loaded devices at the site where the drug is actually required. Where the problem is there, we can implant such devices loaded with the drugs at the desired site. That's another advantage here. Third advantage is there will be no side effect. Why? Because you are delivering the drugs at the desired site only. So that's another advantage. Third, next advantage is, say in case of cancer. So when you are delivering the drug at the desired site, definitely no side effect, because the drug need not to travel a long path. It is delivered at the desired site only. So that's why that's the advantage of such drug delivery system. And another advantage is this is a controlled drug delivery system. It releases the drug at the desired minimum rate and for a prolonged time. That is another advantage. You need not to take drug after every 6 hours or after every 10 hours, 8 hours. No. Once you implant that device loaded with the drug at that desired site, it will start releasing the drug slowly and slowly at that site automatically. So that is the advantage of such controlled drug delivery systems, and that's possible with the help of such smart materials. Let me, before I give you a brief introduction about your body structure, your internal body system. This is a stomach. Here the pH is around 2. And this is the pH of our blood system. You find pH with blood levels, and the different blood pH levels are here. You'll find that the normal pH of the blood, it ranges between 7.35 to 7.45. If it is more than 7.45, alkalosis takes place, which is poisonous. And if it crosses 7.8, and death may take place. And in case of a lower pH level, if it goes behind 7.35, acidosis takes place. And if it falls below 7, the death may take place. So this is highly specific. The pH range is very narrow range, but very specific in the body. This is the pH of the different organs, GI tract in our system within the body. So let me give you certain examples here how the control and sustained drug delivery system is very important in the body. We can take example of dopamine here. The absence of dopamine causes Parkinson's disease in the body. The drug can mimic dopamine in the brain, but when we are giving this dopamine from outside, this drug will act as a hormone rather than as a neurotransmitter, since it has to travel the body, travel around the body to reach the target. That's the main problem. If it travels throughout the body through a long pathway, when it is delivered from outside, what will happen? This means drug could potentially switch on all the dopamine receptors around the body. Actually, drug is required in the brain only, but it has to travel a long pathway through in the body. What will happen? It will switch on all the dopamine receptors around the body, and once it travels and switches on the dopamine receptor on the body, what will happen? This will lead to a large number of side effects. Large number of side effects will take place. That's the main problem with the traditional drug delivery system. Another example, you can have drug-food interaction. See, we can have an example of tetracycline here. What happens in case of tetracycline? When we take tetracycline, it has the property to bind very strongly with the calcium. So we should never take milk and related food products immediately after taking the calcium. Tetracycline, because it forms a complex with the calcium. Once it forms a complex with the calcium, definitely it will not be in a position to get absorbed in the body, and taking of that tetracycline that carries no meaning. So that's again another limitation of the traditional drug delivery system. I'll give you another example here. Say, we can have the example of cholestyramine. When we take the cholestyramine, what happens? If you take the thyroxine or warfarin immediately afterwards, it will form a complex with that. Warfarin and the thyroxine and drug-drug interaction will take place, and the impact of that cholestyramine will not be. This cholestyramine is a blood thinning or cholesterol lowering medicine. That's again another problem. Drug-drug interaction is another problem with the traditional drug delivery system. And a lot of anesthetics I have given here, you will find that these anesthetics, they are, because of their affinity for lipid layer, they get absorbed over the lipid layer and get slowly released into the bloodstream at the time of operation, and that's the main problem. That's why in case of fat person, the doctor is not in a position to estimate how much drug has to be given to a particular patient. Terphenadine, which is the product basically, and drug is fexofenadine, and we give terphenadine. Once we give terphenadine, what happens in the body under the impact of P450 enzyme, this is a battery of enzymes in the liver, it gets converted into the active drug, that is the fexofenadine, and this fexofenadine is antihistamine agent. But the problem here is, if you take immediately grapefruit juice with immediately after taking the terphenadine, what will happen? Its metabolization will get inhibited, because this grapefruit juice, it lowers the activity of P450 enzymes. Once the activity of P450 enzymes is lowered, you'll find that the terphenadine metabolization will be lowered. But the problem here is, if in the blood the concentration of terphenadine persists in the body, it causes a lot of cardiac toxicity. That's the main problem. If the traces of terphenadine, if the terphenadine doesn't get converted into fexofenadine, it will cause cardiac problem. Heart problem honi shuru ho jayegi. That's the main problem with such a system. And this is a fexofenadine, which is the antihistaminic agent. This is the insulin. Nowadays, there are mini pumps which deliver the insulin automatically into the body, into the bloodstream, depending upon the glucose level in the blood. So this is the system nowadays which is coming up very fast. Another application of such materials in biomedicals is that in case of wound dressings. You'll find that in wound dressings, a lot of characteristics are there of such materials. The first one is, it can minimize the scar formation on the skin. It minimizes the scar formation in the skin. It strengthens new tissue formation. It provides protein healing, absorbs fluid from inflammation. It blocks nerve endings to reduce pain. Encourages natural blood clotting. Forms barrier against the infection, and provides a scaffold for cell growth. So such materials, they are of great importance in biomedical. They act as scaffolds. In case of injury, they are of great importance. One of the example is that of chitosan here. The membrane of chitosan is of great importance in biomedicals. It acts as an anti-hemorrhage first aid hydrogel membrane. It doesn't contain any therapeutic or pharmacological agent. It itself is enough, sufficient. It does not interfere with the body's natural coagulation mechanism. That's a property of the chitosan. If it is applied simply by pressure to the source of bleeding. You simply apply the membrane to the source of bleeding. You will find that positive charge the sponge absorbs the blood and accelerates the aggregation of negatively charged platelets of the body, and the bleeding will be stopped. It acts as a mechanical barrier also and prevents blood loss by accelerating formation of a temporary blood clot. So that's how important this material is in biomedicals. Next, importance of such materials, I am coming to the concept of self-healing. Self-healing is very important, including your own body. Self-healing is one of the most fascinating features of biological system. You will find that whenever there is cut, automatically after some day, the self-healing will take place and you get healed up. The skin gets healed up. The injury gets healed up, such as skin, bones, muscle tissues, etc. So this is a natural process which is occurring within our body automatically. You'll find that here, in case of we are preparing the certain self-healing materials, in such materials, constitutional dynamic chemistry plays an important role. This constitutional dynamic chemistry is a very important chemistry and is playing very, very important role in the fabrication of self-healing materials. You find here, this is a material. We cut this material into two parts, and after cutting this material into two parts, you'll find that then you put them together, and after some time, you find them automatically that these two parts they get healed up and become inseparable part. Quite enough strength. That's how such dynamic association and decision of the cross links takes place here. So there's some importance of such materials. They are of great importance in mechanical engineering, in biotechnology fields. In case of mechanical engineering, you'll find that the deformation may lead to micro or macro scale cracks in the machines, thereby leading to gradual deterioration or sudden loss of mechanical properties of the machines may take place. And if there is sudden loss of mechanical properties, you'll find that there's a big loss to the company. So if such materials are of great importance in mechanical engineering, where the self-healing could take place automatically, and there will be no loss to the company. In case of biotechnology, you see when there is a cut, there is always risk of infection because of microorganism intrusion. But through self-healing, by making the use of such materials, where the cavities they will get healed up automatically, and we can avoid the infection of the microorganisms, infections due to microorganisms. See how it takes place. These are two parts. You put them together, and automatically self-healing will take place, and material is one piece now. In case of three parts, you'll find you put them together, and again self-healing after some time happens automatically, and it becomes a one piece with different colors. Smart materials which are having intrinsic ability of automatic damage, repair, or triggered by external stimuli. So such materials are, again, we can call them as smart materials. Spontaneous formation of new bonds happen when old bonds are broken within the material. There's a continuous formation and deformation of the bonds which takes place. Breaking down of bonds and formation of new bonds takes place here. That's the smart chemistry. Characteristics of some such materials, you'll find that when such materials are applied, you'll find that there's a direct mass transport at the affected area occurs, and through the physical and dynamic chemical bonds. That's again the characteristics of such materials, and you'll find that the elastic mechanical properties are restored. So there's again the characteristics of such materials. You'll find here, say, how different types of dynamic covalent bonds are operating, and how different types of other bonds are also operating. Non-covalent interactions are also taking place. Different types of dynamic covalent bonding, the imine bond formation, coordination bonds, Diels-Alder reaction, electrostatic interactions, and then in case of non-covalent, you will find hydrophobic interactions, host gas interactions, hydrogen bond, disulfide bond, etc., etc. And this type of bonding in such materials take place. Applications of self-healing materials, they are of great importance in drug and cell delivery systems, tissue adhesives, biosensors, 3D printing, antiseptic dressings, coatings, sealants, automobiles, aerospace, building media, etc. So they have great importance in different fields. So already I have shown you both non-covalent and covalent bondings operate in case of such materials. Now, this is one of the example here where this animal is injured, and through such materials, the self-healing materials, the tissues and medicine have been injected at the injured space, and after some time, the animal the injury gets healed up. A self-healing takes place automatically, and this is how it is happening. And you will find that they get self-healed, the tissue they get self-healed, and you find there are dynamic chemistry bonds, and dynamic chemistry comes into operation, and physical crossing also take place simultaneously. This is how this animal is cured and gets cured with the passage of time by using such materials, injectable materials. So they are of great importance. You will find here the drug delivery by intravenous injection, and another is in comparison is in situ drug delivery by self-filling hydrogels. There are better advantages as compared to the drug delivery by intravenous injection, because IV injection, IV delivery, you will find here it's a low efficiency, toxicity from high concentration of drug in the blood, and frequent injections are required. Whereas in case of self-healing, you'll find that efficiency is very good, toxicity is less, and less injections are required. That's the difference between the two. Nanomaterial-based self-healing materials. We can prepare the nanomaterial-based self-healing materials depending on different sources, and different types of such materials can also be prepared. Some of the work is being carried out in our own laboratory. We have prepared some self-healing materials in the laboratory. We have taken biodegradable natural backbones, and we prepared the gel out of those, and different they were shaped into different forms, and you'll find that automatically we got self-filled materials, and this is the material, and this is self-filled material. And this was prepared in our own laboratory, and they are of great importance. You'll find here, if you prepare the nano gel materials here, they are of great importance in the killing of the bacteria. Such materials, presence of gold or silver nanoparticles help in killing of such materials, such bacteria, and at the injury. So they can be used as membranes at the injured space. So this is the how, this is the mechanism how self-healing takes place, and different types of bondings they are operating, and these materials have been prepared in our own laboratory, and we have devised this mechanism for such self-healing materials, which we have prepared in our laboratory. And this is again, we have prepared these materials in our own laboratory using different types of cross-linkers and vinyl monomers, and different types of reaction take place, Michael addition reactions and redshift base reaction and hydrogen bonding may take place during self-healing. And these are the materials which we prepared in our own laboratory. And this is a before self-healing. After 4 hours study, after 4 hours, you find that they got healed up, and this is the self-healed material here. Similarly, in this case also, we prepare the disc and we separated this inner part, and then we put the inner part within the disc, and you'll find that it got healed up, and automatically inseparable one piece was formed. Sorry. Again, This is a stepwise self-healing process which was carried out in our own laboratory, and we prepared these materials in the laboratory. And say you'll find that how this ring it got healed up at one side, and then it got healed up at the other side. Also, we formed a ring. A complete ring was formed through self-healing process. So this is the our work carried out in our own lab, how this self-healing material was prepared, and this is the gelatin, carboxymethyl cellulose oxidized one, and dextrin oxidized one, which we have taken here. And these are the materials which we carried out in our own laboratory. So again, they were studied at different. Their stability was studied at degradation. They were studied at different pH levels, as per in phosphate buffer and 5 molar urea also. And these are the studies which were carried out at different pH levels. Their degradation behavior was studied. So then some of the rheological study, we also studied some mechanical properties with the help of mechanical engineering department, and we found that they can be used for the preparation of the artificial tissues. And then blood compatibility test was also carried out. The hemolysis ratio was found to be around 2.73%. And nanogels. Nanogels in a sense are nano-sized hydrogels. Nanogels have emerged over the last few years as an effective vessel for carrying and releasing drugs to the patients. This small size means that nanogels have a high permeation. Nanogels these days, they are having a great role in the fields of science and technology. I will talk here about the nanogel composites. Nanomaterials, nanogel composites are synthesized by incorporation of nano-sized materials. So we can prepare such nanogels by incorporating nano-sized materials into the matrix of the gel, and we also prepare such materials in our laboratory. They have great importance in the trigger drug delivery release, in guided therapy, and in hypothermia, etc., etc. So this is how nano gels can be prepared, and this is the nano particles. Then this is the hydrogel matrix, and how it can be incorporated into the gel matrix. Application of nanocomposite hydrogel nanocomposites in different fields. So, yes, is there any problem, please? Can you mute your mic? Hello? Hello?
Kindly mute your microphones, please, participants.
Please mute your mic, please, because I am getting disturbed. So, these such nanocomposite hydrogels, they are of great importance in different fields, as I've shown in the slides here. So, including the degradation of different types of dyes. Hello? Hello? Hello?
Mr. Flavingo Dominigos, please mute your microphone, please. Mr. Flavio.
Hello? So,
you can continue, sir.
Okay. So in our lab, we have prepared these nanogel composites, silver-based nanogel composites we prepared in the laboratory, and these were the materials we could prepare in the laboratory. And we'll find we also studied the impact of reducing dose and silyronite concentration on such materials, there are different concentration of silver nitrate and different radiation, gamma radiation dose ranging from 1 kilo gray to 50 kilogram. We studied these observations, and the same type of studies are carried out on IPNs. We prepare, because we have prepared the semi-IPNs and IPNs, both types of materials we have prepared. And again, on IPNs also, we studied the impact of radiation dose and serum nitrate concentration on their physical appearance. How do they appear with the variations in radiation dose and with the variation in serum nitrate concentration? Yeah, hello. Hello. And such those materials which were prepared, they were characterized by using different types of techniques, including your time. And we also studied such materials, the semi-IPN, IPN-based nano composites, silo nano composites for antimicrobial activities at different bacterial strains. And the standard use here was amoxicillin. Amoxicillin was used as a standard, and we found that these silo nano composites, they showed very good activity in comparison to the simple semi-IPN and IPNs. These are some of the results which we could get, and these materials, nanogel composites, they showed very good results. Say you find yourself, these are results for the amoxicillin, which was used as a standard, and this is the nanogel composite, silver nanogel composite, and again this is the result for those of IPNs and amoxicillin, and this is the nanogel composites. So these are structure of gram-positive and gram-negative bacteria here. This is defense large in peptidoglycan cell wall, and you'll find that this is how the antibacterial activity of silo nanoparticles is there. So this is antibacterial wound dressings, how we could heal up the wound in case of with the help of such materials, and there's a mechanism involved here. And we could also prepare the such nanogel composites using carbon nano dots. So this is a mechanism how we could prepare the gel, and then how these carbon nano dots, they were introduced within the gel matrix. Similarly, with different sources, the insertion of carbon dots was there, and we could prepare that. So these materials can also be used for the treatment of wastewater, because everyone knows about that. Why we need the treatment of water. That's very important, because we are polluting the different sources of different natural sources with the industrial effluents. So, and such effluents, they have got a lot of impact on the human beings. Carcinogenic impact is there, toxicity is there, and a lot of other ailments are also there. They are spoiling the aquatic life system. They are spoiling the plant life, and even our ambient environment temperature is disturbed quickly. So there are various methods for the treatment of water: chemical method, physical method, and biological treatment methods are there. But here, we can go for the treatment of water with the help of such materials. And such materials can be used in the form of as a nanogel composites for the treatment of the degradation of various types of dyes under the impact of sunlight or UV visual radiations. This is a mechanism, some of the work which are carried out in our laboratories, a mechanism how the different types of dyes, they can be degraded with the help of such materials. So we prepared ferrite nanoparticles, and we could use effectively them for the degradation of different types of dyes. This is the characterization which was done, nanoparticles. And the CBB and the FB dye were used, and they were degraded with the help of such materials under the impact of sunlight and UV visual radiations. These are some of the results which we got. Positive dye uptake and mineralization. And how many cycles they can be recycled, and up to 5 times they can be effectively used. Such material can be used up to 5 times, 5 cycles. Yes, they can be used up to 5 cycles very effectively. And this is a mechanism. We have device here how they can be used. And this is the GCMS analysis of the dyes after degradation. Yeah, GCMS analysis of the dye FP after degradation. And this is how we can compare the impact of sunlight and UV radiations under the impact of how the dyes they got degraded and to which extent they got degraded. And we compared our results with the results already existing in the literature, and it showed good results. You'll find that although time was more in our case, but almost the degradation is good. So, role of such materials in eco-friendly farming, can they be used can they be of great importance in our farming system or not? That was very important for us. Yes, green revolution, whether curse or blessing, everyone knows about that. You know, we have to salute the father of green revolution, Dr. M.S. Swaminathan, who was the project director for bringing the green revolution in India between the year 1967 to 1978. Because India was facing a lot of food scarcity was there in India immediately after independence. And he was a person who could bring the green revolution in India with the help of Dr. Norman Borlaug from Mexico, who supported green revolution through the introduction of high-yielding variety of wheat seeds. So, no doubt, we got the green revolution, but at the same time, we used intensive chemicals, agrochemicals, to increase the yield, crop yield. And because of this green revolution, this resulted in a record grain output of 131 million tons in 1978-79, and established India as one of the world's biggest agriculture producers. And nowadays, our markets, they are flooded with different types of food articles, and there is no scarcity. But the problem is, I cannot breathe. I am facing a lot of health hazards. Chemical toxicity is there. I am eating chemical food. I am drinking chemical. I am breathing chemicals and everything chemical. Nothing natural. So, because what are the consequences of intense agriculture? The poisoning of soil, weak yield, and farmers, they are committing suicide. Crops are prone to more diseases. Salinity is there, and eutrophication is there. The aquatic life is getting spoiled because of eutrophication. That's the main problem here. And another is biomagnification. Our body is getting accumulated is accumulating a lot of heavy toxic metal ions in the body and other poisonous chemicals in the body because of biomagnification through food chain and food web. Again, that's the main problem with this green revolution. Intensive use of agrochemicals. So, you'll find here every Indian, it eats around 2 kg of pesticides every year. That's the main problem. The land is becoming barren. And 1 out of 7 cases of cancer are hastened due to high amount of pesticides in the diet. I can give you a beautiful example of apple here. Would you like to eat the central one or in the periphery apples? Because this central one, No doubt it's good looking, but it is chemically treated. It's treated with a form, chloroethyl phosphonic acid. You just add 2 to 3 ml per liter of water and give it spray 1 week before harvesting. You'll get a good color to the apple, but it is chemically treated. It will harm you if you eat it. You can increase the shelf life of the crops, shelf life of fruits by just dipping in a solution of 4% calcium chloride. It will increase the shelf life of your fruits and other articles. Fruit, in case of fruit ripening, you can make use of calcium carbide, which releases acetylene. You find here, the ethylene is a natural aging agent in fruits, but we are releasing acetylene, which resembles ethylene. And this acetylene helps in quick ripening of the fruits. And again, we are eating the chemical fruit. We are making use of a lot of fungicides, herbicides, insecticides, and other chemicals in our crops. That's why we are getting a lot of chemicals that are getting accumulated in our body. Oxytocin, very common these days, and we have which is used for quick milking and other increasing the size of your fruits and vegetables. You give its injection. It costs just 50 paisa per injection. But we are poisoning our food with the help of such chemicals, by using such chemicals. Don't panic, eat organic. Yes, organic food, fresh food, good food. No chemicals, no pesticides, no synthetic fertilizers, no genetically modified.
Dear participants, please make note that there is a network problem in the resource person's connectivity. So he's just getting connected. Please be tuned. Will be connected to the resource person in a couple of minutes. Please stay tuned, please. Please stay tuned while we are getting connected with the resource person, please.